Hi, my name is Jameisha. I'm with Ore-Ofe and we're here to talk about Be Part of Research. Happy to have you here.
Thank you.
Well, we can first just dive in. You currently live with sickle cell anemia. Can you tell me what that is for people that don't know?
Absolutely. So sickle cell anemia is a blood condition. It's a genetic disease where you get it from both your parents. And it just basically means that the body is not able to carry oxygen. The red blood cells specifically, which it carries oxygen around the body, is not able to do so. That's because it has broken down and it has formed a sickle shape, which is similar to what you'll see as a crescent moon. So it has formed a sickle shape and it has now blocked the veins, so preventing blood flow and therefore preventing oxygen from reaching other parts of the body. Now, this results in what we call painful crisis. One is in crisis, and it can affect any part of the body, and the person just feels excruciating pain. Obviously, pain at the time, pain level differs, but it can really be quite severe, needing hospitalization, depending on where it is in the body and the treatment that is needed to alleviate the pain.
And with you living with sickle cell, what is it like living with sickle cell? What's your day to day?
My day to day now being a mom has changed from my day to day, like say 10-15 years ago when I was carefree and I was living for me, right? Right now I wake up, I know signs of when I'm about to get a crisis. Funny thing is that sometimes a crisis just sneaks up unaware and I'm like, I have to deal with this. But every morning waking up, the first thing I think about is, how am I feeling in my body? Is there any pain anywhere? Is there anything I need to do to elevate certain types of pain for that day, right? And it's what I think about mainly, just because now I'm a mom. I'm not just living for myself alone. I have these two creatures that are depending on me, with every I love them. They're depending on me, right, for everything. And as I said, I'm not living for myself alone. I'm living for them as well. So I need to be the best version of me so I can be able to take care of the children. I have to look at my body. Am I in any pain? What do I have for the day? Do I have to cancel some activities because it's going to be too stressful for my body? Sometimes I just have to stay home and rest. That could just be putting my feet up and just playing some activities with the children at the time. Day to day is really different. But the first question I always ask myself is, how am I feeling in my body?
That's a really good question to ask. I feel like everyone should ask that, but specifically with people with chronic illnesses and sickle cell specifically. That sounds like a lot to balance though. So even though you're looking after yourself, it still sounds like a lot of brain space that takes up.
It does. I don't want anybody to limit me. I want to be able to do anything, everything that my counterparts without sickle cell do. I do understand that sometimes having this disease does limit me, but I don't want somebody to put that limitation on myself. I want to be the one to be able to call the shots and say that I don't think I can do that engagement today. Let me move it to another day, kind of thing, right? It's life. It's how I've grown up because sickle cell really is. It's an invisible disease, so-called invisible disease, right? You can't tell that I have it just by looking at me. It's maybe if I'm really, really poorly, then you could ask or suspect or something like that. But apart from that, living with this invisible disease, and having had to navigate all sorts of life decisions, I've faced with all sorts of challenges, right, that I've had to overcome.
You mentioned earlier that you have two beautiful children, which you still have to balance your sickle cell symptoms with. But when it comes to having your first child, were you nervous with someone with sickle cell anemia getting pregnant and, carrying a baby?
It was nerve-wracking for me, just because even before before I got pregnant, I'd always think about it, how is this, how am I going to cope with the pregnancy? How am I going to carry the pregnancy? Because I already have, sickle cell crisis can be triggered by various things, including stress. So I'm like, stress, I'm working full time. I'm trying to navigate the weather, which is horrible. I hate winter, and just navigating all of that. So when it came to pregnancy, just seeing how other women who don't have sickle cell take pregnancy, and it's kind of stressful for them and their bodies. I was more so nervous for myself, knowing just scared that my body won't be able to handle the pregnancy. And it's something that occurred to me a lot. So I was extremely nervous. I was really scared. I was like, oh, I'm pregnant. I want the baby. I don't want to go through the pregnancy though, right? So it's like, oh my goodness, what are we going to do now?
Wouldn't that be nice in general as well, just for them to arrive?
I think so. Or, the olden days when we used to tell the children that, oh, stork will deliver your baby sibling. I'd love that.
That would have been great. While you were pregnant and obviously dealing with the stress and anxieties, you decided to take part in B-Passive research. So can you tell me what that was like?
Yes. So I was part of a feasibility trial study that was run by a team in the Guy's and St. Thomas, part of the Guy's and St. Thomas Trust. What they really were looking at is if frequent blood transfusions could reduce the amount and the severity of sickle cell crisis in pregnancy. So it was a randomized study, and I just got chosen. Very blessed to have been chosen. And being chosen for that research changed the outlook of the pregnancy for me, and it changed my experience as well.
In what way? How did it change?
The study changed my outlook and my experience during the pregnancy, because I wasn't having frequent sickle cell crisis as I would have. And it just enabled me to enjoy my pregnancy. This is a young couple expecting their first, there's so many giddy moments, and not having a health scare at the back of my mind, that enabled me to properly enjoy the pregnancy, and being hopeful of just having this first baby. For the study, what that study really meant was that I'd need to go in for frequent blood transfusions. It wasn't a normal blood transfusion, it's an exchange blood transfusion. They're removing my blood from one arm and putting in the donor blood in the other arm, but then it's kind of a concentrate. It's red blood cells, right? Which is what I need, the red blood cells. And I did it. I started when I was about 20 weeks, and it ran up until about a couple weeks before I delivered my baby. I had 3 sessions. It didn't seem a lot. I mean, some people just like, oh, you have blood transfusion 3 times, but that's life-saving blood transfusion for me because, as you know, when you're pregnant, the body diverts all resources to the baby, leaving the mom with, and they still do that really. Children, they still take everything from you, right? But I mean, the body diverts all resources to the baby and leaving really little for the mom. So having had that blood, I'd say is life changing for me. It was life changing for me. I did not have as many sickle cell crisis during the pregnancy. It was extremely manageable. I was happy. I was excited about the pregnancy. And I guess that's what brought us here, right?
Like, not only were you part of research, but it seems like taking part also alleviated some of the anxieties that you had while pregnant.
Yes, it did. I'd say that I have to really commend everybody who was part of that research because from the very beginning till after I had my baby, they were constantly checking on me. How am I feeling? So to make sure mentally I'm okay, emotionally I'm okay. It's not just the health part, right? Being part of the research, I'd say is not just because of the standard of care that you may receive, but also because it is essential that we are part of research. I'd say I was scared when I was chosen to be part of the research, even when they first approached me, because as a mom, you're carrying this child. You don't want to do anything that's going to put your baby inside your womb in harm's way. You'd want to protect your baby with everything you have. So for me, I'm like, doing a blood transfusion, how is that going to impact my baby? Okay, I get it's going to be beneficial for me, but how is that going to impact my baby? I felt responsible for my baby's health, even though she was still inside me. I felt like it's going to be my fault, whatever happens, right? So I was so being part of the research was really it was scary for me. I felt a bit anxious in that regard. But then, the clinicians and the support staff that were there, that was tied to the research, they all helped elevate my concerns. I had so many questions. I went to go and do my own research, and I asked every single one of questions I needed to ask, and that helped me feel that okay, I can go on, I can be part of this research. I really do want to give kudos to the team because they really were there. They really did support me. Being part of research, I think, is also important in the regard that we all have, I say that we all have a part to play in this world. We are all tiny pieces in this huge puzzle, and we have a specific part to play. No part is greater than the other. So a clinician doing a NHS study is not any more important than the patient who has the disease, right? So I think it's quite important in that regard because I knew before I had my children, I knew that they would have I knew that they'd be carriers of sickle cell, right? So I wasn't just doing this for me at the moment. I was doing it for them in future and for their own children and future children, future generations to come, right? Because as I said, we all have a part to play, and what's the legacy we're going to leave the future generation, right? So that's also what was playing at the back of my mind in all of this.
a lot, but important things to ask. And I liked what you mentioned there about almost like the collaborative nature of research, that patients taking part is just as important as the people doing the research that are analysing the data and stuff, and how that helps future patients and medicine in general.
Absolutely.
So it sounds like you had an overall good experience. So then I guess I would ask, would you do it again?
I do it for a second time. Funny thing, when I was pregnant with my son last year, I went to the lead clinician and I was like, "Are you doing a trial? Can I please be part of it?" I genuinely asked that because I believe in it so much. I believe in the benefits. I believe the results that they get. I believe that this is going to be used to change policies and procedures, which is going to better the lives of our children and future generations to come. So absolutely, I would be part of within a hat strap. I'll be part of a research. I believe in it so much.
I have a chronic illness as well. I have lupus, and similarly to sickle cell, it affects Black people that are South Asian, and people of colour in general. How can we encourage more people from those backgrounds to take part in research as well?
I think it's just a change in their mindset. Everything is all in the mind. I remember when I was doing my own research, I did struggle to get participants because even though I was looking at sickle cell, as you said, it mainly affects people who are of the minority. Their belief was they're tired of being pricked, prodded, and the thing is that if you see yourself as that, it's going to be a hindrance in moving medicine forward, technology forward. How are they going to know how to tailor services to us if we don't volunteer, right, and tell them what works and what doesn't work? Some people don't feel like they are able to fully express themselves. They don't feel as though they're able to share their concerns, and they do have a lot of concerns. They do have a lot of fears, and they're just whispering among themselves, right? They're not saying it out loud. But how are we ever going to bust some of those myths if we don't vocalize it, right? So I think what we need to do is that we need to tailor it to them specifically, right? And to just encourage them to come forward, create a safe space where they can ask their questions, because there's no question that's too small or silly when it comes to life-changing matters, right? We need to be sure of what we're doing so we can forge on ahead, right? So it's just tailoring it to them, creating an environment for them to ask their questions. I think also it's the belief that they're not going to see the change. I understand this now. We want to see the change right now.
I do.
I do as well. I think for some of them, we need for some people, we need to just change the mindset that the change may not be now in 2025. It may come in 2027. It may come in 2035. We hope it's not that long, but it will come, though. You know, you think about the world where your children are going to grow up in, your grandchildren are going to grow up in, and you want it to be safe. You want them to have everything they need. I think if they have that mindset that they are important as they are, and that they have something within them that needs to come out so we can create change, I believe, I really hope, and I believe that we'd see a difference in the minorities participating in research.
And I think, as you're saying, change doesn't come immediately. It takes time. When we look at some of the news on the poorer health outcomes of Black people, Asian people in this country, it's extra important to take part in this research so that, as you mentioned, for our grandchildren or grandnieces and nephews, from in my case, that they have better outcomes than us. And I think even for me, like, I've seen some changes even within myself having lupus. I know that before, if you went on the website, it would say that the lupus rash is pink, and now it says it may appear in other colours for darker skin. So these changes, they may have taken time, but maybe sooner than we think. And so hopefully people feel safe and encouraged and emboldened to take part in that research for that change. So you spoke about the anxieties that you had living with sickle cell and also being pregnant. So why was it important for you to take part in a clinical trial?
It was important for me to take part in clinical trial despite my anxieties, my personal anxieties, just because I saw that it would benefit future generations, right? Even though my children aren't going to have sickle cell disease, they'd have the trait, and they may want to marry somebody who has sickle cell disease or the trait. And I felt that all of this information that would be gathered from the trial would be beneficial for future generations. I saw it as my way of giving back. I feel responsible to future generations who have sickle cell and sickle cell trait, because I have it. And if this is just one little thing that I can do that helps make their experience a bit better, then I'd gladly do it, despite my insecurities and the anxiety.